Okay, so this is a case central retinal artery occlusion with loss of vision in the side of the left eye. So this is something that can happen as a result of a sudden occlusion of the artery, and it could be from a cholesterol crystal that just works its way back into the retinal circulation. It causes a blockage, and the vision, if it's not moved, then any vision that any portion of the retina that is supported by that artery the vision is lost. And so it's typically a sudden onset type of problem. The treatments are really limited for this. Some people are beginning to do injections into the eye, like are being done for macular degeneration. Others are trying hyperbaric, which possibly may work. I'm not really sure. It's really new. Otherwise, there's really not much else. So sometimes they put people on massive doses of steroids to try to preserve the vision. May 8th, 2014, this 71-year-old woman experienced a sudden dark cloud over her left eye with complete loss of vision. Vision began to partially clear after a few days, turning into a pink cloud. She suffered a complete loss of depth perception, extreme dizziness with eye movements or head movements, and had noticed a reduced color vision, especially red. She was overwhelmed in complex visual environments like going to the symphony or shopping, things like that, and she doesn't feel like her eyes are working together very well. I saw her 3 weeks after this event, and at this point she can now see some shapes, and she finds that when she turns her head and her eye to the extreme left, that she can see some letters on the eye chart. We found in her right eye 20/25 minus 2, so she missed 2 letters on the 20/25 line, so 1 line worse than 20/20, which is normal. Left eye 2200, so that's legally blind, and this is with her best corrected vision on. However, when she turned her head to the left and her eye turned to the left, she could make out 20/50, so not terrible. She had some vision there. She had very poor contrast sensitivity in the right eye. We were completely unable to test the contrast sensitivity in the left eye. She just couldn't see the targets at all. Impaired color vision in the right eye. On the left eye, she just absolutely could not do the test at all. So no. She had no response to stereo testing, so she had no 3D at all. And to walk, she uses 3 different canes. So she would try different canes with different, like a single point cane or a quad cane, or different types of canes like that. She was just feeling very unstable. She didn't know where she was in space, and this dizziness was just really difficult for her. She has a diagnosis of glaucoma as well, hypertension, thyroid problems, COPD, chronic obstructive pulmonary disease, osteoporosis, and many years ago she had LASIK surgery in both eyes to correct nearsightedness. She was also receiving OT and PT, occupational therapy, physical therapy for balance and the balance problem and dizziness. I only did coMra with her. We did 6 sessions once a week. The protocol was Universal 1 plus optic neuritis, which is the 2 minutes at the temple plus the scanning over the eye bone above and below. 1 minute lateral aspect of each eye through the eyes, the closed eyelid, and the eye in adduction, turned in towards the nose. After the very first treatment, she came back and reported that the balance and dizziness had significantly improved. The OT and the PT that had been working with her were very surprised by the sudden improvement. So there was no reason why it should have improved that quickly just by doing OT and PT. The vision in the right eye was 20/30 plus 2, and now was best corrected of 20/40. So it improved from 20/50 to 20/40 in the left eye. So 1 line of improvement after just the 1 treatment. We continued on for 5 additional treatments once a week. And her progress overall after the 6th visit, we did a progress evaluation. She's seeing the iPhone. She startles less on the left side, so she's able to be in more complex visual environments where people approach her from the left side and she is not always has a startled response. Her maneuverability is hugely improved, particularly in tight spots. Virtually no dizziness with eye movements. She's able to go to the symphony, rarely experiences visual overwhelm anymore. She rarely uses the cane at all anymore. Balance is almost normal. She feels like her eyes are now working together. Her husband's comment, and this is really interesting, was that initially the dog was her constant companion, and wherever she went, the dog would go. The dog was really worried about, that she was not well. And now the dog's behavior has changed dramatically from worried and constant companion to allowing her to go places by herself. So I thought that was really significant. The final visual acuities were 20/25, -1 in the right eye, and the left eye 20/40. Con sensitivity in the right eye had improved from a 20/80 equivalence to 20/30 equivalence. Initially, in the left eye, there had been no response at all in the higher spatial frequencies. Now has a response. Color vision, significantly more targets on color testing. Stereopsis is now present, now responding with 200 seconds, whereas previously there had been no response. So after that, I didn't see her for a long time. She recently came back for 1 year following the event. Interestingly, her ophthalmologist noted a surprising lack of cellular degeneration. So normally when there's a loss of, when there's no longer, the retinal tissue is no longer receiving blood to the area, the tissue itself will just degenerate, and there will typically be degeneration posteriorly. So it will start at the retina and it will work its way back into the eye. So he noticed that there was a lack of cellular degeneration. So that's interesting. The cloud that she noticed is still present, but she can shift it out of the way by moving her eye off to the side. The glaucoma is still progressing with some slight loss of vision on the side in her right eye. She is driving locally now. She had stopped driving before because she just didn't feel confident enough to drive. Her best corrected vision in the right eye was 20/30 +2, so just one letter less in the right eye. 20/30 -2 in the left eye, so it actually improved in the left eye from 20/40 to 20/30, -2 letters there. So tiny bit of improvement there. The stereo vision had also improved one line to 160 seconds, so from 200 seconds to 160 seconds. So improving. So in summary, visual improvements are generally holding. My other comment is that at this point, she could certainly benefit from doing the coMra for the glaucoma. So that would be something that I would recommend at this point.